Any questions in relationship to Morgan?
I was just going to add to that, September, that one of the challenges that we face in launching these kind of products is that there's the first filter of finding someone in the bariatric space who has endoscopic skills. So I actually grew up in obesity. I worked on the lap band, I worked on the bib, and one of the advantages of a surgical device is that we could go to a general surgeon if they were an early adopter and start building on their practice. But we're going to be challenged to find not only people that meet that, but also have endoscopic skills, which typically your bariatric surgeon, your general surgeon don't have that training in endoscopy. So all the things you mentioned are spot on, but that's one more tactic that we're going to have to look at as well.
Thank you. And Bill mentioned in his presentation that there is no substitute for lifestyle modifications. On the panel, we have two panelists, Dr. Kaufman with DPS Health, and you're providing online tools for people to change their behavior and get into more of a healthy lifestyle. Why don't you describe your business, and there's obviously complementarity between what you're working on and what Bill is working on.
Sure. Thank you very much. I mean, if you think about what's happened in the last 5 years with technology, we would not have imagined that we would have cell phone apps that could do the things that they do. You would not have imagined an internet that's able to do streaming video, streaming audio, and other effective e-learning. And what we find is that the old paradigm for behavior change interventions, and there's actually a large amount of a research body, said an individual would go to see a counselor, that skilled counselor would meet with them maybe 30 or 40 times over a year, an hour a week at each time, and give them support, information, help them set their goals, help them improve their behaviors over time. And it works. The landmark study, the Diabetes Prevention Program, NIH funded back in the 90s, 3,200 subjects, 27 sites, highly effective at decreasing weight and keeping it off, 10-year outcome data even after the study was done and people were still doing well. The problem was it cost a fortune. It was unaffordable and unscalable. And so what our company did was we built a platform that can provide behavior change support. University of Pittsburgh, that had the ownership rights to that actual program, hired us to build their program. So this is an example of a behavior change intervention that cost a fraction of what it originally cost by automating 90 to 95% of the interaction. By 95%, that means that there's still a 5 or 10% component that's clinically linked. So the other part of the world out there is there's going to be a big fight, and it's actually an important and actually a very healthy fight between direct-to-consumer applications that have efficacy perhaps, that certainly are going to be adopted by many people. Think of the iPhone iPhone apps versus clinically linked programs that are in the context of a therapeutic relationship. And it's hard to tell which is going to win. My guess is both will, and that there will be ones that are linked into clinical settings and ones that go direct to consumer. They'll kind of look similar over time, but I think that's an important thing to be looking for. In terms of the kind of programs and products that we're talking about today, the capacity to go to scale both with the product, with the endoscopists and all the others that are necessary, but also to be able to go to scale with the behavior change support, I think is what will really make the most long-term benefit, long-term outcome.
We have an extensive experience.
Lifestyles is Mr. Tom Kinders, who runs Bariatric Advantages, Inc. in Irvine. And you provide products for those who've gone through gastric bypass surgeries and lab band surgeries.
Yeah.
Can you comment on the same subject matter?
Sure, exactly. Yeah, we've been in the business for about 8 years, and so we've followed all the major procedures that have been done, and starting with gastric bypass primarily, and that's where the nutritional issues have been well documented. But with all of the procedures, the same patient group that's having a procedure is an obese patient, a morbidly obese patient. So they come in with a series of comorbid conditions related to nutrition a lot of times, and those things are still they'll still present no matter what procedure is taking place. So to piggyback on what you just commented on, the biggest issue for the people that we deal with, we work directly with the surgical programs, and then they hand over their patients, and we follow them for an extended period. The biggest issue is compliance down the line. After they're out of the honeymoon phase with any of the procedures, they've lost a little focus on being a patient, and now they're back to being just a human being. it's really hard for them to stay compliant with their nutrition, their behavior, and all these different changes that have to go into place. We launched a mobile app, if you will, called iComply in October of last year. Right now, we send 500,000 messages to patients who've had weight loss surgery every single day, and it pops up on their cell phone and reminds them to take their vitamins. I mean, as small as that is, the outcomes are phenomenal. And the programs, we work with about 1,500 bariatric programs across the country, and probably are in about 60 programs where every one of their patients go onto the system. So it's really important, this aftercare and lifestyle behavior change.
Any comments on this subject matter? No?
I'll comment on that because I've been going around to a number of the centers where Tom's products are. And as I talk to the centers of excellence, is that surgeons have evolved in this space from procedures to being required for reimbursement purposes to understand long-term outcomes. It has become a more holistic view, and the long-term lifestyle changes and behavior modification are absolutely critical to success in this area. Absolutely critical.
Did I see a hand? No? Okay.
I actually think that it brings up, though, another important key component, though, looking at how you approach the market is social media. Given the changes in the dynamics, I think that does open significant opportunities for smaller companies that are trying to break into the space, or you can cost-effectively go in with social media. And then the second component, I think, that was just raised in terms of looking at the holistic approach in terms of treating and managing the patient is looking at practice-building management for your professional audiences, which is a way to break through, create loyalty and adoption on the physician perspective, and be able to differentiate yourself. And there's still a lot of room there for growth with practice-building management.
John Tucker, Caton Associates. I guess when I listen to all this, the question that comes to my mind is how much of this is just a question of driving cultural change? I can still remember the Marlboro Man when I was a kid, and Winston tastes good like a cigarette should. We used to sing that song in 4th grade. Looking up at the slides we just saw here, I recognize I can drop my risk of cardiovascular disease by a very substantial amount if I lose another 10, 20 pounds. But somehow our culture tolerates this, whereas cigarette smoking is something that the state of California now pays for advertisements, which are, let's just say, they're extremely uncomplimentary of tobacco executives. And so to come to my point, are there ways to leverage the financial resources of other parties that have a financial interest in reducing the obesity epidemic to perhaps drive growth in this space? And I'll just leave it at that.
I think you're 1,000,000% correct if you look at the transitions from 1950s to now in terms of what's normal, portion size, hidden calories and fats. So there's both public policy initiatives that are necessary. There are local activities that need to happen. I'll put a pitch in for my wife's book called Diabesity, which she wrote when she was the president of the American Diabetes Association, which gives you the social, cultural, biological, and evolutionary basis for obesity epidemic that exists in the United States and what impact it has on real people, both patients and others. There are other books like that, but hers is really actually quite good. The bottom line is that to really make a difference, this panel is not the right panel to make a population-based difference. You do need an ecological approach where you think about all aspects of what may cause it. So it gets down to how do you help people to feel more comfortable to walk and to be active? How do you get them to have access to foods? How do you change school policy so that as my wife was able to do, get sodas out of LAUSD and now actually out of almost every school in the country. There's a number of environmental changes that need to happen. But the subject of this particular panel is within the medical world, how can devices, how can surgical or non-surgical interventions make a huge difference on that individual patient? But you're right, it's going to be a drop in the bucket compared to the tens and 50, 70 million people in America who have prediabetes and the 20 million that have diabetes already. It's not going to solve that problem by itself.